Hello, welcome. Today's guest lecture is on creating climate adaptive primary healthcare system framework and challenges. I am Chami Samarasekar from the ANU College of Health and Medicine, and I'm joining from the Australian National University's beautiful campus here in Canberra. Before we start, I wish to acknowledge the Ngunnawal and Ngambri people, the traditional custodians of the land I am today. Recognize any other people and families with connection to the land of the Australian Capital Territory and the region. I also know we are joined by people from around the world, so I would like to welcome all Aboriginal and Torres Strait Islanders and Indigenous people who may be attending today's webinar from across the country or anywhere in the world. So let me now introduce you to our amazing presenter, Dr. Nayoman Sudhasar. Dr. Sudhasar is a public health physician with a PhD in public health, health systems, and policy. He's a well-reputed and internationally recognized published researcher and a senior lecturer at ANU, and has been commissioned research projects from various international agencies, including the WHO, ASEAN Office, Ministry of Health of Indonesia, DFAT Australia, and Ford Foundation. Most recently, Dr. Sudhasar has successfully secured several research grants from the ANU Indonesia project, the ANU Global Research Partnership Scheme, and the Rural and Remote Health Services. He's involved as one of the ASEAN primary investigators for ASEAN's serological surveillance study on COVID-19 vaccination, which spreads across Singapore, Indonesia, Malaysia, Thailand, the Philippines, and Vietnam. Dr. Sudhasar is also a part of primary investigators for two large population-based surveys to measure true vaccination coverage for Japanese encephalitis and COVID-19 in Indonesia, involving more than 14,000 responders using recall surveys and validation methods. So I invite Dr. Sudhasar to take over and conduct today's webinar.
Yeah. Thank you very much, Chami, for the introduction. And good evening, everyone. So I'm also from Canberra in Australia. So it's late afternoon here, and I don't know what time in your local time at the moment. But I'm very happy to be part of this webinar. And today I will be talking about climate change, as well as what can be done by the health system, particularly primary healthcare. So that would be my key topics that I would like to discuss today with all of you. So as just a starting point, so what I would like to cover in the next couple of minutes, essentially to discuss pathways by which climate change actually can affect population health, and intersecting vulnerabilities. So I'm not quite sure how many of you are actually familiar with the concept of vulnerabilities. So we will be exploring a little bit about vulnerabilities between climate change, environmental risk, geographical isolation, and also ill-prepared health system. And the last would be discussing a little bit about adaptation strategy for a primary care setting. So if time allows, I will present my latest research in Indonesia, looking at frameworks for primary care resilient, climate resilient primary healthcare in Indonesia. So this is just to give you some ideas around climate situation across the world. So we, in Australia, you can see the color is yellow, orange-ish. So we actually have a lot of issues in relation to climate. So we rank mid-range of climate risk index. But there is some areas that rank higher in terms of their climate risk index. So in some of the region, for example, this is some of the area that are covered by extreme weather events in the last 20 years. So you can see here some are located in our region, in Asia Pacific region, some of them located in Southeast Asia region, and also some are in South Asian region. So that's a different risk category across the globe in relation to climate events. So what is climate change? So that's probably the first question that we need to have similar ideas or understanding around climate change. So climate change essentially described as an anthropogenic emission, so that will increase warming by 0.5 Celsius in terms of the global temperature. And IPCC, which is the global body for climate change, predict the global temperature will increase by 1.4 to 5 degrees by 2100, so 77 years from now. So it's maybe another generation from my generation. And as a result, we will also be looking at global rainfall. So annual average will increase in high latitude areas, but will also prolong drought in mid to lower latitude areas. So it's a mix of effects. So in some areas, we will see lots of rains, floods, and perhaps landslides as well. But in some other areas, we will be looking at a lot of droughts, and also potentially will be related to water scarcity and also food insecurity. And climate variability will be increasing as well. So what do I mean by climate variability is some of the temperature will be really, really high, but in some days the temperature will be really low. So the range will be increasing. That what we have been observing so far in some of the region, including the Asia Pacific regions. We will also be looking at more extreme weather events, such as storms, droughts, flooding, hailstorm, heat waves, bushfire, and many other extreme weather events across the globe. And we've seen the example of this as well in perhaps in your region or in Asia Pacific region, including in Australia. So why do we care with climate change? So this is just an example of a study related to bushfire that happened during 2019 and 2020 in Australia. So this coincide with the pandemic, as you can see from the year when the bushfires happened. So in 2019, 2000, that last 4 years ago. So you can see here a lot of people actually killed by the fire. So the wreck killed by the fire. It's not many, so 33 people, but still, it's a casualty related to bushfire. But what more important is actually when we're looking at the secondary death in relation to smoke contamination of the air because of the bushfire. More than 400 people actually died because of the smoke-related complications. And we see 1,000 of hospitalization across the region, either in rural and remote region, but also in bigger city like Canberra is also affected by the bushfire. And if we're looking at broader than that, so 12 million people is actually exposed to air pollution just because of this single event. And we also observe tertiary effects, increased mental health issues related to bushfire, but we don't really know yet in terms of the long-term health impacts of this single event. So this event is classified as a short but very intense, moderate to intense severity in terms of the impacts. There is also different ways of looking at bushfire. There is a lot of mild bushfire, but longer term. But this one in particular is a moderate to medium exposure. So we will have to see and wait in the next 10, 20 years, looking at the effect of this single event to the population health in Australia. And this is different way we can think about climate change and health. So I think more and more evidence now pointing out that climate change indeed have health consequences. So there's multiple pathway in relation to how climate change can affect health. So there is as you can see here, there is a direct effect, for example, through extreme weather events, injuries and death related to the event itself. But there is also a lot of events or health-related impact that mediated through environmental changes. For example, increase in temperature or increase in air pollution or reduced water availability that will affect health indirectly. And there is also socially mediated effects to health outcomes. For example, there is a lot of climate refugees, as we can see in some part of the world, Bangladesh, for example. So there is a lot of climate refugees internally or externally to outside of Bangladesh. So that also can lead to conflict. That conflict can lead to health effects. So that's an example of how socially mediated effect from climate change. The other example in relation to poverty, for example, so that will exacerbate the effects of poverty and as a result, the effects on health outcomes, particularly related to climate change. So there is multiple pathways or three different pathways where we can talk about climate change and health. So direct health effect and environmentally mediated health effects and also socially mediated health effects. So this just to give you some ideas. This is the climate parameters that we normally measured. So including race, average and extreme temperatures, ocean acidification, and also other air pollutants. And that's the health parameters that we're normally looking at. So in terms of the health sectors, we will be looking at more and more evidence around the effect of climate change on undernutrition. Also impact on mental health, as it's increasing evidence now that climate change has a strong association with mental health within the population level. And there is also exacerbation of multiple non-communicable diseases, in particular cardiovascular diseases, respiratory diseases. And in some areas, we will be looking at harmful algae bloom. So that will affect the quality of ocean, as well as can potentially lead to multiple waterborne diseases. And climate change has also have a direct effect on the density as well as the spread of the vector-borne diseases, in particular mosquitoes. So we'll see now more and more areas that previously do not have a lot of malaria or dengue cases. Now we start seeing a lot of areas with dengue and malaria cases, even though previously it's not well spread in those areas. So the increased patterns, geographical location will change because of the changing climates. So another issue that I think that I need to mention in relation to climate vulnerability is the rural challenges. So because I also work at the Rural Clinical School here at the ANU, so I feel it is important to talk about rurality as part of the climate change discussion. So in rural areas, so we already experience a lot of challenges in terms of the access to healthcare services. So it's reduced accessibility to quality health services, simply because geographic location, but also limited availability of those facilities. So different pathway or different factors associated with this reduced accessibility. For example, distance travel. So you need to have at least a car to be able to access a service in a rural setting. You need to travel hours to get into healthcare facilities. And also lack of specialist care. So simply just they don't have enough specialist care in rural settings. So to be able to access specialized services, they need to go to a regional or to a urban setting. And from a GP perspective, because there is limited services and limited staff, so GP often have high burden of work, so high workload. So that's also result in high turnover in terms of the healthcare professionals in rural and remote setting. And economic welfare is also associated with job opportunities and risks of the job available in rural settings. So it results in limited financial stability. And also there is a lot of climate dependent sectors within rural and remote setting. For example, agriculture. So if you experience prolonged drought, there is a possibility that your crop will fail. And as a result, you will have economic instability moving forward. So that's also a direct implication of climate change to rural livelihood. And cultural background, we also seen a lot of socioeconomically disadvantaged subgroups in rural and remote setting that will also affected by changing climates. And health equities, we also seeing a higher burden of infectious and non-communicable diseases within rural and remote settings. So it's not just in Australia, but across the board. And that will also lead to higher complication. And that means that the combination of higher burden of non-communicable diseases and infectious diseases with limited accessibility will increase the potential implication and perhaps deaths in relation to diseases for rural and remote communities. So this is just an example of what happened in a rural and regional area. As you can see here, flood can affect everything. So it affects food chain and supply. It affects your access to healthcare facilities. It affect your access to clean water. It affects your access to wash facility, water and sanitation facilities. It have multidimensional effects on human livelihood, not just health, but health is often the end result of changing climate. So we normally deal with people who already experience health problems. But often in a healthcare setting, we don't deal directly with the environmental determinants. We deal directly with the patients. But this situation need to change. So we in the health sector, we also need to be an advocate for climate to prevent such catastrophe like the thing that you can see in this photo. So yeah, so there is also a different way that we need to talk about climate from a health perspective. Yes, we talk about climate sensitive health risks, as I mentioned earlier, but we also need to think about vulnerability factors. So what kind of population are we dealing with? So if you say, for example, you live in a community that have a lot of elderly population, for example, they have different vulnerability to climates in comparison to young adults. So changing in 1 or 2 degrees Celsius, it has a lot of complication for their health outcomes in comparison to young adults. So we need to think about demographic factors when we talk about climate vulnerability. And geographical location. So we need to understand in what area are we living and operating. So are we dealing with flood sensitive area, or are we dealing with drought vulnerable areas? So different hazard need different adaptation strategies. And that's the reason why we need to think about geographical factors. And biological and health status, that is also important. So if we are dealing with a lot of issues around vector-borne disease, for example, the adaptation strategy might be slightly different in that setting. And socio-political condition, of course, who will provide the funding, how the government perceive risks and vulnerability around climate change, and also how the society actually has been responding to the climate crisis. In terms of the health system capacity and resilience, so we also need to think about leadership and governance, especially from the state or government perspective, and the availability of the health workforce, as I discussed earlier. Do we have integrated surveillance system as part of our health information system, so that we can combine environmental data and health data to see the patterns on the area, so we can predict what might be the health consequences of the climate variables in your area. So do we have agile essential medical products and technology supply chains, for example? Do we have enough buffer capacity? Do we have enough surge capacity if extreme events happen? So that's often something that we need to think about when we're designing adaptation strategy for the health system. Service delivery. So do we have alternative service delivery mechanisms? So when the road, for example, becoming inaccessible, so do we have different modalities? Do we have technology in place to deliver service remotely, for example? So that's something that we need to think about as well. So financing, there is a lot of discussion now talking about co-financing between climate and health. So that potentially where the climate financing will also be discussed in the next future. So same as well, when we talk about health financing, potentially we will also be talking about climate financing within the health financing system. So that just to give you some ideas that climate change actually intersect with multiple dimensions. So it's not just related to environmental determinants, but it's actually linked directly with socio-economic, socio-cultural, socio-political, and also social dynamics within a particular society that will lead to health outcomes. So as I mentioned earlier, so there is a direct health outcomes as a result of climate change, but the majority of effects or the majority of health effects from climate change is actually mediated by changing in the environment, but also socially mediated. And that's the reason why we need to understand these intersections. This is just a different way of looking at the effects of climate change. But what I would like to highlight from this graph is actually in dealing with climate change, there is two key measures that we can do. So one is climate mitigation. So we try to reduce the emissions. So we not try to modify or how can we adapt to this changing and mitigate the effects from climate change. So mitigation essentially try to reduce the carbon emissions. So we mitigate the primary source of climate change. Whereas adaptation refer to strategy that we can do to minimize harm. So, and that adaptation can take place at the to mitigate environmental effects and also to stabilize ecosystem, for example, or to cope with increased salination and storm, and also directly related to health outcomes. So that's something that we considered as an adaptation. So in health sectors, a lot of the measures that we can do is related to climate adaptation. Yes, we can do some mitigation strategy, for example, shifting away from coal or fuel-based energy sources to solar panel, for example. That's another mitigation strategy. But the majority of the strategy that can be done by health sector will be an adaptation strategies. So this is just some example that I would like to highlight, and we discuss a little bit about extreme weather events. So for example, flooding is the most common effects that we often seen in media. And that's simply because we have a steady increase in rainfall. So increase in rainfall, that means that the flood risk will be also increasing. And on the other hand, there is also a prolonged drought and fire. So that's also precipitated by extreme weather events, and both of these climate events can lead to food insecurity and water scarcity. So you can see from environmental effects then that will lead to food insecurity and water scarcity that has a direct implication for human health. So food insecurity, so this, apart from the flood and prolonged drought, that can also be attributed to warming land surface. So increased temperature in land surface that will reduce the viability of the crops. So often in some cases, it will lead to failing crop altogether. And this negatively affect food production and supply chain. You can see that the warming land surface, flooding, and prolonged drought as an environmental determinants will lead to reduced food production and supply chains that have a direct effect on human health. Same with vector-borne diseases. So climate change alteration will alter or disturb the traditional seasonal weather patterns that will cause expansion of factors such as dengue and malaria. So when the factors increasing, so we see a higher density of malaria or dengue factors, for example, the direct result will be more bites to human and transmission of these diseases to human. And pollen and spores has also been studied quite heavily. So that's linked to exacerbation of respiratory diseases. That's also include thunderstorm asthma. So in Australia, we have a very specific disease is what we call thunderstorm asthma. So asthma that exacerbated by a small particle of the pollen that trigger your asthma attack. So these also triggered by prolonged drought and increased weather, and the spore will crack, and that will increase your exposure to pollen and spore that will lead to exacerbation of your respiratory conditions. This is just how to give you some ideas how environmental determinants then link to a potential health effect for human. So once we touch all of this issue, and then I think it's also important to talk about primary care. So on my different slide, I will be talking about primary care framework specifically, but I think it's an important area. So because a lot of this affect, a lot of this condition and a lot of this mitigation adaptation strategy will took place at the primary care level. So I think it's important to talk about primary care preparedness. If we're looking at primary care preparedness, there is a lot of issues. We have less certainty around rural health capacity and vulnerability because we have limited data. So if the question being asked is how prepared is the rural areas in relation to climate change, so the general consensus might be they are not prepared. But the true answer is actually we can't really say much because we don't have a lot of data. And for that reason, it's more and more study in rural and remote areas are required. The second point is adaptation strategy. So yes, there is a lot of discussion around adaptation strategies for different sectors. And now we start talking about climate resilient health system, which is essentially a package of adaptation strategy that can be implemented through health system. But again, it requires more support. So yes, the consensus is there, but financial support is not very reflected in the current practices. Health service preparedness is still ill-prepared, so we don't take a climate lens when we're designing or when we do the health system planning just yet. And ongoing assessment on climate vulnerability and capacity is required. So as I mentioned earlier, so we don't take into account climate variable just yet when we do the design and planning within the health system. And primary care is the key resources. So you're probably aware that primary care is actually available up to the community levels. So if we have the capacity to strengthen primary healthcare to be climate resilient, and that's potentially a bigger contribution from the health sector to implement comprehensive adaptation strategies for climate change. So strengthening primary health care for reducing and mitigating climate-related health impacts, and therefore it's a very, very critical step moving forward in protecting the health of the population from climate change. So the thinking around primary healthcare adaptation or primary healthcare preparedness is not new. So as you can see here, the thinking around primary care adaptation strategy has been proposed back in 2007. So as you can see from this paper. So primary healthcare adaptation strategy can include disaster preparedness, and because climate change can lead to disaster, and primary healthcare need to be resilient for disaster. And disease surveillance of vaccination, we understand that climate change have an effect to infectious diseases, particularly vector-borne diseases and waterborne illnesses. And perhaps disease surveillance as well as a comprehensive vaccination program will be able to mitigate that effect. And also drought and dry condition, it's led to food insecurity, water scarcity, and also affordability of food. Perhaps in primary healthcare setting, we can promote adaptation strategy by providing psychosocial support and also nutritional assessment, including participation of primary care in nutritional assessment within the community. So that's some ideas around climate adaptation. But in primary care setting, there is also possibility to do some mitigation efforts. As highlighted in this diagram, we can promote green clinic program, for example, how we can minimize the use of fossil fuels in a primary care setting, and also how to make carbon footprint within the community health center or primary care setting reduce. That's also a part of the thinking around mitigation strategy at the primary care levels. So the translation of this is, you probably heard quite a lot now, people start talking about green health system or green hospital, or sustainable health system and resilient health system. That's also part of the mitigation and adaptation strategy within the health system. And there is another way of looking at climate resilient health system. This is a frameworks from the WHO. So the discussion around climate resilient health system has been discussed, but the implementation of these frameworks is actually still very limited in a country in a country level. So at least from did quite a bit of research around climate and primary care in Indonesia, and I can say from Indonesian perspective, these frameworks hasn't been implemented just yet. So I will touch about these frameworks a little bit on my second slide or second presentation. So what can be done in primary care setting? So there is several ways that we can do in primary care setting. We can start with public education and awareness. If all community health center or primary health care conduct public education and awareness, the reach of this activity will be massive, because they are valuable up to the community level. So we need to start thinking around early alert system or early warning system for impending weather extremes events, and also infectious disease outbreaks related to climate change. Some community health center or some primary health care, they do have early warning system for particular diseases, but we need more comprehensive early warning system. Disaster preparedness, that's another thing that we can do at the community health setting or at the primary health care level. Strengthening infectious disease control programs, including food safety, vaccination program, factor control, case detection and treatment. So that's something that can be effectively and efficiently implemented at the primary care level. So we need also to promote integrated surveillance, to include risk indicators and health outcomes, to include social variables, but also environmental variables, and then combine that with the health outcomes data, so to be able to predict the effect of climate change. And we also need to think about health workforce capacity and supply. So in terms of linking education and health system, but also take a climate lens when designing and planning for health workforce capacity at the primary care level. So that's just to give you some ideas what can be done at the primary healthcare levels in terms of the adaptation strategies. So I will change my slide and I will share another slide with you. So to give you some context, how can we create an adaptation strategy at the primary care level? So I probably need to stop share to start with. Bear with me, I will. Okay, so this is a paper that I presented earlier in a health system symposium in Japan. So, but I'd like to share with you some of the ideas that we or some research that we conducted in Indonesia. But again, so I will bring back my key argument here that the primary health care is actually crucial for climate adaptation for health. And there is a lot of rationale for that. So for example, mitigating the effects of climate change on health outcomes. We discussed this already, require adaptation within the health system, especially within the primary care settings. So why primary care setting? Because primary care is very close with the potentially impacted communities. So there is a strong need to strengthen the primary care setting. And primary care providers are the front line. So in dealing with both direct and indirect health effects of climate change. And as you can see earlier, or as you can understand from the previous presentation, that many feasible health impacts essentially will be managed by primary care setting. Only difficult cases will be referred to a hospital setting. And therefore, climate resilient primary health care is crucial. So moving forward to mitigate health impacts of climate change. But just to be clear that this is actually not to create a parallel system, but is actually as part of a strategy to strengthen the overall primary health care in a country. So we don't want to create a different system dealing with climate change, but we would like to strengthen the capability and the capacity of primary care to deal with potential climate change effects on human health, or to use climate lens when we are designing primary healthcare system, or when we're designing primary healthcare service delivery, for example. So that's really critical to start thinking around climate resilient primary healthcare. So the research that we conducted in Indonesia, supported by DFAT, so Department of Foreign Affairs and Trade in Australia. So one of the objectives of the research is actually to develop locally informed climate resilient primary healthcare framework. So I will go through that very quickly shortly. So we conducted the study in 3 different areas, in 3 different islands, so Bali, Nusa Tenggara, West Nusa Tenggara, and also East Nusa Tenggara. So let me explain or share with you some of the key findings in terms of capability and gaps. So health providers and local stakeholders, they recognize the imminent effects of climate change on population health outcomes. And however, as I mentioned earlier, action to mitigate these effects actually still very limited. And primary healthcare providers, they are not equipped with a health adaptation plan to mitigate potential harms from climate change on health outcomes. So there is some overarching health adaptation for climate change, but the implementation at the community level as well as primary healthcare is actually very limited. So there is also a strong consensus within the study participant that primary care should play a crucial role in health adaptation strategies. And key functions within the primary healthcare are relevant to mitigating health effects from climate change. For example, all of the health center in the study location actually have implemented preventative and control measures for vector-borne diseases. And also they have quick response team if any disaster happens. So they actually have some capacity and capability to adapt to or to mitigate climate related events at the community level. So, but there is a lot of key gaps, as you can see here. So inadequate capacity to prevent direct trauma or injury, including heat stroke. So they do not implement disaster risk assessment. They do not conduct environmental temperature monitoring. And they also do not do air pollution monitoring and surveillance. And also they don't have surveillance staff at 38 community health center. Functional alarm and fire alert system is still very limited. Almost half of them didn't have. Clean access to clean water is also limited, 47%. And as I mentioned in the previous presentation, lack of surge capacity and also lack of continuous climate assessment and integrated surveillance system. It's also very, very limited within the primary care setting. So, and this information then, we use this information then to talk to primary care providers, but also with policymakers in local area to come up with what is climate resilient primary healthcare might look like. So we came up with these 7 principles or objective of the climate resilient primary healthcare. So this is the criteria that we agreed on when we define climate resilient primary healthcare. So it's a primary healthcare that can protect and promote the health of target population from climate-related risk, and a primary care that can provide environmentally sustainable healthcare services, mainstreaming climate-related risks. So as I mentioned earlier, we need to use climate lens when we do climate health planning, assessment, and decision making. And integrated and continuous vulnerability, capability, and adaptation assessment. That's also the criteria that emphasized by our study participant. And a primary care that can promote and adopt a place-based adaptation plan. So again, so it's not just based on the environmental factors, but it's based on what happened within that area. So we need to looking at the environmental, geographical, socio-political, socio-cultural, as well as socio-economic assets within a particular community when we design an adaptation plan. And it's also need to include multi-sectoral and whole of society approach in implementing the adaptation plan, and also integrated focus on monitoring and managing future climate-related risks. So this is the criteria that we came up with when we have a discussion with the community members, primary care providers, and also local stakeholders. And this is just the frameworks that we came up with. So as you can see here, we have 4 strategic levers and also 8 operational levers. So this is the area. So we have an area around governance and leadership dimension. So for example, a clear action plan and have contingency plan for climate-related events. Protocols, it's also one of the criteria that we use. Cross-sectoral coordination meetings need to include climate issues, clear policy and regulation documents, and also partnership between facility, NGOs, and local community. So that's some of the indicators that we propose for the governance and leadership dimension for climate resilient primary health care. And in terms of the health workforce dimension, we identify skill and competent health workforce, competency in disaster management, emergency response, environmental health, integrated surveillance and risk mapping as one of the key dimension, adequate number of staff with sufficient capability and sufficient surge capacity. So that's linked with one of the gaps that we identified. and also incorporating climate-related issues and vulnerability and risk into health workforce planning. Again, using climate lens when we do planning for health workforce at the primary care level. So health financing dimension, we need more funding from the government, and also availability of contingency fund, availability of incentives, so that come quite a lot from our study, and also purchasing and payment must accommodate financing for program and activities related to climate change. So as you can see, there's a lot of activity that can be done by the primary care, but that need to be supported by flexible funding mechanism. So in terms of health infrastructure, we're looking at building quality, density, distribution, wash facility, and power supply, communication technology, emergency transport, storage for the vaccines and cold chain, and also integrating climate consideration in planning and buffer strategy. So that's a key dimension for health infrastructure and facility. Community linkages, so collaboration between facility and community engagement, outreach strategy, climate risk vulnerability communication strategy. So that's also part of the community participation dimension, and active involvement of community in health promotion related to climate change. There is also digital health components within the framework, so including the use of digital infrastructure and readiness, and also use of digital technology for service delivery and monitoring the outcomes. Models of care and health programs, as you can see from the previous one, we need to create program package that related to climate sensitive diseases, and also integrated surveillance system, emergency with fast response team must be available, emergency management and also disaster management activity need to be strengthened, capacity to accurately diagnose, treat, and refer health-related climate issues. So that's also an important component of models of care and health programs within the primary care. And monitoring, research, and evaluation, of course, risk assessment related to climate change, as I mentioned earlier, is really critical. Adopting a list of key indicators, we need to include key indicators for climate-related health risks that monitored quite regularly. Written adaptation plan and early warning system is also very critical. Analysis of surveillance data to assess quality and monitor climate-related disease is also critical. And using climate and environmental related information from other sectors to inform risk assessment within the health sector. So this is just some ideas and criteria that we can use and implement at the primary care level to make the health system and also primary care more resilient toward climate change. And this is also important to inform the way we design and create adaptation strategies at the primary care level, including at the health system level. So as a key takeaway, I think we need better alignment and strengthening of health system function at primary care setting. And these frameworks hopefully will provide strategic guidance on how the primary care sectors and its operational basis can be systematically and effectively address the challenges presented by climate variability and change. It can also facilitate and can improve our ability to anticipate, prepare, prevent, and manage climate-related health risks at the community and primary care levels. And it will also provide guiding decision within health sectors and decision-making in other health determining sectors, including water, agriculture, emergency management, and also environmental units. And hopefully it will also facilitate resource allocation and focus investment for public health, primary care strengthening, and also climate change adaptation at the community level, at the primary care level, but also more broadly at the health system level, more broadly. So I will stop there and I will hand it over to Chami, and hopefully we can have some discussion if you have any issues. And you can also reach me out through a new email address, and you can also send an email to Chami if you have further further question, or if you want to collaborate in relation to climate-related research moving forward. So I hand it over to you, Chami. Thank you very much.
Thank you so much, Dr. Herman. It was a very informative and a very extremely timely conversation to have about these things. Our Q&A session is open if anyone wants to put their questions in, but also you can raise your hand if you would like to ask them directly to the doctor. So please indicate if you want to ask them directly, and I will unmute you to the session. Don't seem to have any questions at the moment, but as Dr. Sudhasar said, please do reach out to him if you have any questions after the webinar today, or if you want to collaborate or learn more about the research he's doing in the region and the future projects that might open up, but also maybe reach out to us if you have any other questions that you might want to discuss. I would probably give it a few more seconds before we end the session. If not, again, you can always reach out to us via email.
Yeah, that's a really good point, Chami. So this area is emerging. So if you're interested in research, or if you're interested in pursuing further career in health-related sectors, I think this is a really good area to tapping into. And we have a lot of capability here at the ANU to provide you support, and also to provide you support and a lot of expertise in this area. So for any one of you who are interested in doing further research or further higher degree by research in this area, so feel free to reach out directly to me or to Chami at the college level. So they will be able to connect you with the right people.
We don't have a question, but just a comment saying it's a very informative lecture. So just thanking you for the lecture. So I guess we do not have any more questions. So I will end this session today. Dr. Sudhasar, thank you so much for dedicating your time and going through all this information. It was extremely informative, as I mentioned earlier, and as our audience have mentioned. And thank you all for staying along for the entire session and being engaged with us. So I hope everyone has a really great day. Thank you so much.
Thank you. Thank you, everyone. Thank you, Chami. See ya. Bye-bye.